very warm welcome to this convergence of ideas, innovation, and impact in healthcare. Every breakthrough in healthcare begins with a question, every solution with a collaboration, and every transformation with the courage to translate knowledge into action. Today, in this auditorium, we come together not just as a participants of a conference, but as a contributor to a shared vision where research meets reality and science serves society. On this note, we, Kritika Gautam, lecturer, Department of Optometry, and my co-host,
Roshna Sengupta, Assistant Professor, Department of Optometry,
have the honor of anchoring this program and to guide you through today's proceeding.
it is with immense pride and honor that we welcome you to the 7th International Conference, Recent Advances and Challenges in Healthcare, REACH 2026, sponsored by Avion, PhysioWord and Silver Line Laboratories, organized by the School of Healthcare and Allied Sciences, G. Goenka University, Gurugram. We are privileged to host an esteemed gathering of dignitaries, renowned academicians, clinicians, and researchers and industry experts from across India and world. Guided by the theme Translational Health Sciences, Integrating Research, Technology and Care, REACH 2026 aspires to move ideas beyond publications towards practice, policy and patient care.
Over the next 2 days, this platform will encourage interdisciplinary dialogue, innovative thinking, and meaningful partnership that strengthen the future of healthcare. We sincerely thank each one of you for being part of this journey and for lending your presence to this global exchange of knowledge. With great respect and anticipation, we now invite you to join us as we formally begin the inaugural proceeding of REACH 2026.
In Indian tradition, lighting the lamp signifies the dispelling of darkness and the illumination of knowledge. We invite our honorable dignitaries to kindly proceed with the ceremonial lighting of lamp, invoking wisdom, prosperity, and success for the conference. I welcome you all. Give a huge round of applause, everyone. Thank you all the dignitaries. To invoke divine blessings for the auspicious occasion, we now present Ganesh Vandana followed by Saraswati Vandana, which will be presented through a classical dance by the talented students. We invite you to kindly enjoy this soulful presentation as we begin REACH 2026 on note of devotion, wisdom and positivity.
कुछ ज़्यादा ऑक्यूपाइड नहीं हो जाएंगे उधर बैठ के। और बच्चे अपने लिए से
वक्रतुण्डमहाकाय सूर्यकोटि समप्रभ निर्विघ्नं कुरु मे देव सर्वकार्येषु सर्वदा। गणनायकाय गणदैवताय गणाध्यक्षाय धीमहि गुणशरीराय गुणवन्दिताय गुणेशानाय धीमहि गुणातीताय गुणाधीशाय गुणप्रविष्टाय धीमहि एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गणेशानाय भालचन्द्राय श्रीगणेशाय धीमहि एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गणेशानाय भालचन्द्राय श्रीगणेशाय धीमहि गानचतुराय गानप्राणाय गानान्तरात्मने गानोत्सुकाय गानमत्ताय गानोत्सुकमनसे गुरुपूजिताय गुरुदैवताय गुरुकुलधारिणे गुरुविक्रमाय गुरुप्रवराय गुरवे गुणगुरवे गुरुदैत्यकनक्षेत्रे गुरुजन्मसदाराध्याय गुरुखण्डखण्डकाय गीतसाराय गीततत्त्वाय गीतगोत्राय धीमहि भोजयप्रदाय धीमहि गुणातीताय गुणाधीशाय गुणप्रविष्टाय धीमहि एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गणेशानाय भालचन्द्राय श्रीगणेशाय धीमहि
setting such a serene and auspicious tone for Reach 2026 through this beautiful presentation. To formally welcome this august gathering, we now invite Professor Dr. Sahil Arora, Dean, School of Healthcare and Allied Sciences, GT Goenka University.
Very good morning, everyone. Distinguished guests, eminent speakers from across the globe, and esteemed faculty colleagues, our vibrant community of students and researchers. Very good morning. It's a moment of pride for me to welcome you all on the 7th International Conference, REACH 2026, Recent Advances and Challenges on Healthcare. This conference has become a hallmark of excellence. As we started with School of Healthcare and Allied Sciences in 2000, and the conference became an annual convention every year, and this is the 7th one which we are organizing. We are not offering just 2 days event, but also continuing the legacy of intellectual curiosity and professional growth that defines our institution. To understand the significance of today's event, we must look back at the journey which brought us here. During 2022, the 4th conference tackled the immediate challenges of the time, where we discussed the digital healthcare in post-COVID era, wherein we have explored the various technologies which has become our primary lifeline. During 2023, that was the 5th conference of REACH, we discussed on precision healthcare, the way forward, wherein we have not only talked about the individual care, we also discuss about the precision mode by which we can take care of. During the last year in 2025, we bridged the gap between modern tools and the global equity under the theme called Futuristic Healthcare, Bridging Innovation, Accessibility and Sustainability. Each of these options, which we have discussed in the last conferences, has put a foundation for ambitious dialogue which we are starting again today. And today's theme is nothing but translational health science integrating research, technology and care. I'm sure that the gap which we are observing nowadays between the laboratory breakthrough as well as the patient's bedside issues, which is just like a cannon, if I'm not wrong. And over these 2 days conference, our goal is to bridge this gap. We could transfer our technologies which we have developed in the laboratories to the bedside patients, and we can give a healthy life to everyone. With the same, I'm sure that all of you will be enjoying interacting with a lot of people who are here from all around the globe, specifically students and researchers. You'll get a lot of transformation during these 2 days. These 2 days, I'm sure that you will be expanding your knowledge, gaining direct insight into the latest global trends in medicinal chemistry, green chemistry, natural pharmacology, and rehabilitation techniques. You'll be able to bridge the theory as well as practice which is going in various research laboratories, and we'll be able to apply that knowledge into our day-to-day learning capabilities. REACH conference will help us to network with the great researchers around, not only from India but also from different countries. And you will be able to improve your overall skills by interacting with them in future too. Friends, this conference will fuel your career by presenting a paper, by interacting with the scientists here. You will position yourself in the forefront of the healthcare innovation. With this aim, I wish you all the best. As we embark on this 2 days conference, we'll be incredibly fortunate to be guided by the galaxy of professionals, experts here. It is an honor for me to welcome our eminent guests and speakers. I'm expecting Dr. Lokvir Singh, who is the Chief Medical Officer at Civil Hospital Gurgaon. Anytime he'll be here with us. We are joined with distinguished experts, Professor Flavia Giuconi. She is Associate Professor at Pontificia University of Chile. Professor Renu Thakur, Head of Research Optometry at Chitra University. We are expecting her very soon. Professor Dinesh Kumar Cherapan. He is Professor at NICM Health Research Institution, Western Sydney University, Australia. Professor Kamal Dua, again at NICM Health Institution. I'm sorry, maybe I'm a bit wrong regarding the Dr. Dinesh. He is a professor at International Medical University, Malaysia. Dr. Pallav Bhatnagar, he is a principal at Gitanjali College of Physiotherapy. Professor Tevin from Faculty of Allied Health Sciences at Chulalongkorn University, Thailand. Professor Jafar Khan, Dean and Head at Pacific College of Physiotherapy. Professor Kakoi Yong, Lecturer at School of Pharmacy, Monash University, Malaysia. I'm expecting in afternoon session Professor Stephen Kerr, is an Associate Provost for Academic and International Affairs at NCTH, USA. Professor Ivy Chung, she will be joining tomorrow morning with us. She is a Professor of Pharmacology at University of Malaya, Malaysia. Professor Bhupesh Goyal, Head of Physiotherapy at Vivekananda Global University. Dr. Keshav Raj Podal, Senior Researcher at Western Sydney University, Australia, will be joining us again tomorrow morning. Professor Tina Chauhan, Principal of Udaipur Institution of Physiotherapy. Welcome you, ma'am. Professor Vaibhav Agarwal, Associate Professor at Swami Rama Himalayan University, Dehradun. So it is a great pleasure for all of us that today a galaxy of eminent researchers are here. Their research area will not only guide us and motivate us for doing the research, improving our research capabilities as well as learning capabilities. Once again, welcome you all, delegates, researchers.
Sorry everyone for the technical glitch. And thank you, Rain sir, for the insightful overview of the previous and the upcoming current REACH conference. So now we will invite our Honorable Pro Vice Chancellor sir and all the deans of the schools and the organizing secretaries to present the token of appreciation to all the esteemed guests for their presence. So firstly, I would like to call upon stage Dr. Dhirendra Singh Parihar, our Pro Vice Chancellor Administration and Registrar, to kindly come on the stage and welcome our guests. Dr. Nihal, please come on the stage. So first I would like to call on the stage Dr. Flavia. Please, yes. Applause. Next, I would request Dr. Kamal Dua to please be on the stage. Give a round of applause, everyone. Dr. Dinesh Chilakkan, please be here with us on the stage. Dr. Tevin Tempromanau, please be here on the stage. We welcome you. Give a round of applause. Please keep applauding. Next, Dr. Pallab Bhatnagar, please be here with us. Dr. Zafar Khan, please be here. Dr. Kokui Yong. Dr. Sandeep Kumar. Dr. Praveen Rawat, sir. And Dr. Tina Chauhan, ma'am, please come here on the stage. Thank you, all the dignitaries. Dr. Supriya Avasti, please be here on the stage for the warm welcome. please, for the warm welcome of our guests. Now moving forward,
We now have the privilege of inviting Professor Dr. Hirendra Singh Parihar, Honorable Pro Vice Chancellor, Administration and Registrar for the inaugural address.
Good morning, ladies and gentlemen. It's my pleasure to be here before such strong gathering who have been here this morning despite, I won't say inclement weather condition, but yeah, a bit of challenging weather conditions. So, congratulations to all of you for being able to make it to this place. And this shows your strong commitment to the conference that's happening. So I'll start with the university. So GT Goenka University was founded in 2013, and the School of Medical and Life Sciences was the name previously, changed to Health Sciences later on. It has been in inception, since inception in 2016. Yeah. So it's a long time since the school has been there. And we run a lot of courses which are programs which are related to the healthcare, like pharmacy, initially pharmacy, health and nutrition, medical lab technology, physiotherapy. Many of them are still running and they are full-fledged departments as of now. Coming to REACH, I think the 7th edition of REACH, its reach is increasing as every edition passes by. I've been told about some statistics yesterday evening by Professor Sahil Arora, who is the Dean of the school, which said that 475 participants, 100 plus research papers, 30 plus posters, people coming from 5-6 countries, from national universities the 7th edition has grown to a commendable size and proportion, and all thanks to Professor Dr. Sahil Arora and his team, organizing team, which has been working wholeheartedly towards this success since the last 3 months or so. India, as you know, is a focal point of accessible healthcare, affordable healthcare to the world, I should say, and also which is not, there is no technological gap in terms of the offerings which the country's expertise gives to our international citizens. So I think, keeping that in mind, the topics which are here for deliberations and discussions in the days spread over 6 enriching sessions will definitely do a lot good to the researchers, to the students, to the practitioners, and to the thought leaders. With people who are scientists, who are faculty members, coming from Australia, University of Malaya, Malaysia, Thailand, Chile, United States of America. I think it's a global mix which will be here before all of you, and I think you stand enriched at the end of the 2 days process. With this, I again congratulate Professor Sahil Arora for putting this up. I wish him and the organizing team all the success. Thank you very much. Thanks a lot. Have a nice day.
Thank you so much, sir, for your enlightening remarks. So there's an important announcement for the participants who have registered for the scientific sessions are requested to kindly proceed to their respective venues at 3rd and 4th floor as per the schedule. So this session brings together distinguished international experts whose work reflects the true spirit of translation. May we request the session chairs for the session, Professor Dr. Kamal Dua, Professor at NICM Health Research Institute, Western Sydney University, Australia, and Professor Dr. Zafar Khan, Dean and Head Pacific College of Physiotherapy, Pacific Medical University, Udaipur, to kindly take their seats as we begin our enriching technical journey. I request our Registrar and Pro Vice Chancellor, sir, to please be on the dais. So, it is our privilege to introduce the first speaker of the session, Professor Dr. Flavia Zacconi, Associate Professor at Pontifical University Cattolica di Chile and a pioneering researcher at the intersection of green chemistry and sustainable molecular innovation. Her work is characterized by a multidisciplinary approach that bridges the gap between synthetic chemistry, biomedical engineering, and translational health sciences. Dr. Zacconi's research focuses on the development of bioactive molecules and advanced nanotechnologies designed to revolutionize therapeutic strategies. By prioritizing sustainability, her laboratory creates safer, more efficient molecular frameworks aimed at addressing complex global health challenges. A leader in her field, she is dedicated to advancing human health through innovations that are as environmentally responsible as they are medically impactful. She will be speaking on the topic Translational Green Chemistry for Health, Sustainable Molecular Platforms, Nanotechnologies, and Next Generation Therapeutic Strategies. We warmly welcome Professor Dr. Zacconi to take the podium.
Heidi.
Yeah, please. Voice.
Good morning, everyone. It's really nice to stay here with all of you. I would like to thank for this invitation, this important invitation. I would like to thank Dr. Aurora because he trusts in our work just to invite us to share our journey in Latin America. So as you can see, I don't know if you know where I come from. I come from South America. You know, the other part of the world, in fact, at the end of the world, as you say, at the end of the world. As you can see in our map, the red arrow is just showing us our location. Okay, it's really, really far away from India. You are in the orange arrow. So we have to travel almost 1 day to reach this beautiful country. This is my second time here, so I'm really honored. It's not only a pleasure, it's an honor for me to stay here. So I know that maybe it's weird to listen wind chemistry with health, but it's totally related. So this is part of our, maybe our beautiful country, you know, from the north to the south, some pictures. And I know that maybe you know about our big, magnificent mountain that you can see through the space. This is called the Cordillera de los Andes in Spanish. We speak Spanish in all of the Latin American countries, but Brazil, we speak in Portuguese. These are pictures of our city, Santiago de Chile. It's beautiful. It's covered by snow in winter. Now we are suffering the summer. Almost 40 Celsius degree, so it's the opposite from here. So I'm really glad to be here in winter. Thank you. And I belong to the Pontificia Universidad Católica de Chile. It goes UC Chile in English. So we have 5 different campuses all around the country. This is the central campus, so the management and law and economics are there. And these are the other 3 different campuses. And our campus, where we are developing research and teaching, is a beautiful, so green campus just close to the city. It's called San Joaquin, because it's a Catholic university. Each campus is called like a saint, you know. We have an innovation center, and even we have a hospital, so we can do research with clinicians and people who are working directly with patients. So these are part of our statistics, just to know how many people are working, how many students are learning there for undergraduate to postgraduate levels. We have several programs with different universities all over the world: Stanford, Cambridge, Harvard, MIT, Europe, etc. With UTS in Australia too. And I hope in the near future we will have some programs with India. So that's why I'm here too. As part of my talk, I would like to show you which kind of research we are doing, because I'm a chemist. My PhD is in chemistry, but in fact, I started to develop my first part of the PhD in organometallic chemistry. It's not related with medicine, but in fact, I always had the passion to understand the biological part related to chemistry. So my PhD at the end was related to chemical medicinal chemistry, in fact. And after that, I spent a lot of years in Europe working with vitamin D and all of these analogs to develop treatment for cancers. After that, I was hired for UC Chile, and I started this new group in our university. It was unique. It was the Laboratory of Synthesis and Design, because we designed at the beginning with all of the tools that we need to develop a sustainable research. And then we synthesize materials, small molecules, protein, whatever we want. So this is part of our focus. We are focused and we follow the 12 principles of green chemistry. I don't know if you know these 2 gentlemen, Paul Nassar and Joe Warner. They are the fathers of green chemistry. We work really close with them. Olanasta is working in Yale, in the University of Yale. He's the director of the Engineering Chemistry Institute there. And John Warner, right now, is an entrepreneur. So the third principle just rules our research. And this is good because according to this, we are doing the best of our best to don't impact the environment, to impact positively the human being health. So after the first 8 years in UC, we have the pleasure to obtain a really good award because as a chemist, our laboratory is a chemistry laboratory. You know, we are doing the in vitro, in vivo, ex vivo analysis and assays just out of our laboratory. But in 2022, we won this prize called the safest laboratory in our university. And this is a good achievement because we never think that we got it because there are a lot of laboratories safer than us. But in fact, we are working with these regulations and they gave us all the tools that we can achieve this goal. We are part of the American Chemical Society, and this is good because we are working closely with the people that are leaders in this field. So, which is the main project that we are developing since 2012? We are working in thrombotic pathologies. We are working in drug discovery, but not just synthesizing, but not just producing things. At first, we need to design. We need to think really, really hard which kind of new entity we are developing. Because we are conscious that each new entity, maybe, will impact the environment and the human being in a positive way. So this is part of our research. We are using AI, machine learning, deep learning, everything that you are just listening right now, but we are using that for the last 15 years. So as part of our research, we started working with one blood protein called factor Xa, and we developed a lot of inhibitors, direct inhibitors. In fact, if you can see the news, maybe you know about the two commercially available medications, called rivaroxaban and apixaban. They are direct inhibitors from this protein, anticoagulants, but they have a lot of drawbacks, and not only drawbacks for human health, but for the production of them. Okay, so we have this mission, this goal, to develop new inhibitors, but in less steps, maybe with less impact to the environment. At the beginning of our journey, we started doing a humble synthesis to produce new molecules. Only 12 molecules. It's nothing. 12 is nothing, in fact. But we designed them consciously. So for the 12 molecules, 4 of them were really good as inhibitors. It's a good statistic for us. And with this achievement, we were part of the cover of one journal from Brazilian Chemical Society. And the main author of this paper was my undergraduate student. So as you can see, everyone can achieve this kind of success, even if you are an undergraduate. So we are really proud of this, and we start thinking beyond that. So the next level was just to develop a dual inhibitor, not only anticoagulant but antiplatelet activity. So we started working on this, not only with factor Xa, but with other targets. And after a lot of years, as you can see, 2021, okay, after more than less 10 years, we developed a new pathway, only 4 steps. In 3.5 hours, we have a new inhibitor, a direct factor Xa inhibitor that has antiplatelet activity. Only in less than 1 day. Okay? So for us, working with the 12 principle means that we can achieve whatever we want in less time, with less radiation, with less maybe toxic radiation, maybe just diminishing the waste of everything. We are using all the tools, even microwave reactor, even recirculating the water, reusing the solvents. And after we obtain these products in less than 1 day, in fact, we test them in vitro and ex vivo assays. Because we are working with the clinicians, we have the possibility to do all of the assays directly with blood, okay, ex vivo analysis. So after that, we have the great pleasure to have 4 different really good inhibitors that we are going to patent in a couple of months. So after that, we believe and we consider that the core principles and all of the tools that we are working with, they are not only amazing, they are the rules that they are just necessary for developing a new kind of research. And why is this translational research? Because in fact my position is shared between the Faculty of Chemistry and Pharmacy and the Institute for Biological and Medical Engineering. So we are working inter and transdisciplinary. We are working with engineering people just to scale up this process. And we are working with the biologists just to do all of the biological assays. So when you're in the undergraduate or postgraduate level, you need to think that you are not working by yourself. You're working in a really good group. You need a really good group and diverse group to achieve this kind of goals. So you can see several papers, and this is our last project that we are running right now since 2025. You can see there Professor Kamal Dua from UTS, from Australia, and these 5 colleagues are the leaders in their fields. For example, the First Lady, Dr. Duarte, she is amazing working in bioinformatics, machine learning, AI, everything. So she's part of our research since the beginning. So we are working together from the beginning. And then you can see, for example, the other lady, Professor Claudia Saez, she's an hematologist. So she's working with patients directly. So we have this opportunity to discuss from the basic science to the applied science. Okay? And this is so fruitful, in fact, that we always have really good discussions. And another colleagues are working in biology, nanotechnology, and part of this project is the aim is to apply for respiratory diseases. So because thrombotic and respiratory diseases are closely related. So that's why Professor Kamal Dua is there as our international researcher. And at this time, we are, in fact, we are more ambitious because we are not working only with blood proteins, but with receptors, with different receptors that cause inflammation. So we are thinking beyond the basic science just to apply these results. And this is another kind of research that we are doing. This is extremely applied research. As you can see, the title is Emergency System Response for an enclosed environmental with oxygen restricted access. And if you can see the people like they are on the corner in the picture, they are from the army, the Chilean Army and Navy. That's because we are developing new technology since 8 years ago for submarines. Submarine needs oxygen, so we are developing the safest technology for them. And why I have to show you this for you, because in fact this part of the research is not related with the other, but this is part of our development as a chemist. And this should be the first transfer technology of our laboratory. And this is good because when you are working in one topic, topic, maybe sometimes you have the opportunity to expand your research. So this is the way that we are working in innovation, in entrepreneurship, and we specialize in these topics too, not only in basic science. And this is part of our group. This is part of Visione, just to design this system, this enhanced system, to test it in vitro, and now we are testing just the prototype of the solution. And thanks to all of the research that my group is doing, we have the success because the system is not only releasing the oxygen, it's taking the carbon dioxide from the environment. So you have, in fact, after using this technology, the cleanest environment that you can see in the submarine. This is a resume of our work, okay? Just some potentially translational research. And this is part of another kind of research that when we are the collaborators, we are not the leaders, okay? We are just collaborators as a chemist, doing a lot of analytical chemistry, synthesis, analysis, structural analysis, we love structural analysis, and we are working with people from all over the world and from our university. We have a lot of legal collaborations depending on what my collaborator needs. For example, this kind of research are doing by the medical school, okay, the magnetic resonance imaging group, and they only need that we need to understand how we can characterize the metabolites, okay, that they have in each organ after one disease. So this is part of our collaboration. We have a lot of results with them. And I said before about it, part of our research is related with the engineering people, because some of the negative points to produce something new is to isolate, to purify things. We have the blessing that we are working with this engineering from UC, that they are working in supercritical carbon dioxide equipment, and we can just isolate our products, okay, from the matrix with supercritical carbon dioxide without solvents. So this is cleaner, this is safer, and this is really good for our research. And as almost the finish of my talk, I would like to thank Professor Kamal because we have two different grants, more than the other that is the biggest one, with UTS, because our universities has a really good agreement. So we can work together, we can exchange students, we can want new grants. So we have beautiful work together for the last 10 years, I think. This is another collaboration, okay, from our laboratory. We design whatever my colleagues needs. We isolate, we purify, and we can test them too. So after my final minutes, I would like to show you two of the biggest achievements in Latin America, because we organized the first and the second Green Chemistry Symposium. We had the pleasure to invite the fathers of the green chemistry and a lot of collaborators from all around the world. It was the first, and this was the second last November. Camilo was there, and Paul Anastas too. And all of these people wearing green t-shirts, even me, are part of the American Chemical Society and Milano. I truly encourage you to be part of this. It's no profit, you don't have to pay anything, and they will give you. So they are an amazing people, they are a supporting group, and we are working on together for the last 8 years. So if you need just to contact them, just let me know and I contact you with them. As a part of our passion, as Paul said, as Sean said, our dream is that one day green chemistry, all science, in fact, will just be science. Without sustainability, without this world, we don't need this world. Because all the science that we are developing is sustainable, will be sustainable. We know that this is a huge challenge, but we are just doing baby steps. I would like to thank all of our sponsors, all of our brands, all of our colleagues, as you can see. And this is part of my group. These people are amazing, not only because they are compromised with research, but because they are amazing human beings. Okay. Part of our goal as a leaders of a group is to have a beautiful group, beautiful people, not only great scientists. So it's a pleasure to me to have this group. So thank you so much, or in Spanish, gracias. And if you have any kind of question,
डॉक्टर साहब देरी सोना जी लगा दो
yeah. Yeah. We know that. Yes, in fact, it's designed for anti-thrombotic and anti-inflammatory activity both. It's a dual. Yeah. Yes, exactly. Because the drawback from rivaroxaban and apixaban, they have a lot of drawback after 3 or 6 years that you are taking. And this is for sure. And some of them are just for one specific pathology. For example, for knee surgery, for arrhythmia. But this kind of small molecule that we design, they have both activity and less drawback. We hope because we need the in vivo analysis. We need the in vivo analysis in rodents. Okay, after no, we are not. We don't have it. We don't have it. They are designed for 8 hours. Yes, for 8 hours. So if we reach this success, we will be really happy. Yeah. Yes. Yes. Yeah, right. Yeah. And if you think about clinical outputs, some of the COVID outputs was this little thrombotic episodes in your lungs that they discovered after COVID. So when we design this model, we think about it. We take into new software from pharmaceutical industry that they can give us some data that they are not published already. Yes, of course. Yeah. The weekend. And which is the target there? Which is the biological target? That they are not designed. They are not designed specifically for. Okay, according to all of the data that we have, all of the results, we are close to 97%. It's a lot. Yeah, 97%.
The PhD students have just finished and what we just in October.
Yeah.
So everything is at the moment in hibernation, but we need to start another
Yeah, good.
who has developed the compound, particularly in the lab. We are the number one university in South America, I believe, the kind of the research they do. And she's a big winner of a very good research funding from the TS Conference. This is how the research not just telling inside, it's really inside.
Yeah. May I add something? From the beginning of my journey in UC, I was hired to teach chemistry for medicine, kinesiology, dentistry, and nutrition. So I'm really close to the real problems because we are working with these students. So when we design this, we not only think about chemistry, we not only think about the biological target, we think in advance about the output that we need to accomplish. So we know that this is harder, but we are happy that we don't design, we don't produce whatever we want, just the specific thing that we need to do. And this is, I would like to say that we are conscious. We are conscious about research, about science, about development, and about the positive output that we need to have. Thank you.
Thank you so much, Dr. Flavica Zacconi, for these insightful perspectives on sustainable translational chemistry. I would request Dr. Kamal Dua and Dr. Zafar Khan to kindly felicitate Dr. Flavia for her good presentation. Please give a round of applause, everyone. moving forward, our next speaker brings focus to future of healthcare workforce, emphasizing collaboration and interdisciplinary learning. We are pleased to have with us Professor Dr. Renu Thakur. She is highly accomplished optometrist, academician and researcher with nearly 2 decades of experience spanning clinical practice, teaching, leadership and research. She holds a PhD in optometry and is currently serving as professor and head research optometry CRIO at Chitkara University, where she leads multidisciplinary research initiatives and mentors scholars. Dr. Thakur has held key academic leadership roles, including principal and head of department, and has been deeply involved in curriculum development, faculty training, and optometry education at national and international levels. As a passionate educator and clinician, her expertise covers low vision rehabilitation, binocular vision, visual perception, contact lenses, and vision therapy, with a special focus for underserved and diverse populations. She is recipient of multiple granted and accepted patents and has published extensively in reputed national and international journals, and has been invited as a guest speaker for session chair at several conferences. A life member of leading professional bodies such as IOA, OCI and IACL, Dr. Thakur is widely recognized for her commitment to excellence in eye care, research innovation, team leadership and patient-centered practice. So Professor Thakur will be sharing her insights on the topic, the future healthcare workforce, interprofessional education and collaborative research. Give a round of applause to welcome Professor Renu Thakur.
I hope after this there is no lunch, or am I standing between you and your lunch? No. There's one more presentation after me? Okay, so I'm not a villain. Okay, so hi everyone, I am Dr. Renu, and thank you so much for such a beautiful words she has explained about me, and trust me, I'm not going to take much time because I have been on that side also. When a speaker is taking more than half an hour or 45 minutes, I can see the expression which is changing. So I'm going to make it very communicative. Okay, I'll be really happy if you can merge in and we can keep as a discussion. Correct? Okay. So how many optometrists are there in this room right now? I think optometrists have gone for the presentation. Okay. How many physiotherapists are there? Okay, great. How many pharmacology? Okay. So even all of us can relate, and let's start. So the content which I am going to keep for this presentation, what is the present status? I am an optometrist. It's been 20 years in education and research. So I am going to start with the optometry, and then we'll go towards the collaborative work. Correct? Yes. So the present research status, what is the status of optometry at present? What is the collaborative research we can go for? What is the impact of that, and what is the need of today? So the first question is, how many optometry colleges are there in India? If I ask you this question, what you will do first? Students, how many students are there? How many students are there? Just raise your hand. I know it's cold, but you can do some exercise, right? It's good for your muscles. So how many students are there? All these are students? No? Practitioners are there? Wow. So if I ask this question to student, most of the students do Google, correct? सबसे पहले question will go to the Google, and the first answer is given by the Google, correct? And now second famous is ChatGPT, correct? The same question will be asked to the ChatGPT, right? So, but if you want to understand in depth about this question, what is the best way? Anybody? Any student? I'm not expecting answer. What you have to do when you have to find such question? We read article, correct? Which are published in Scopus, reputed peer-reviewed Scopus journal. Now, why I am emphasizing to read a peer-reviewed Scopus journal? Because it has gone under a review process. The material which you are going to get, okay, it is going to be authorized. There is a team which is invigilating that material, and then it is being presented in front of you, right? So all of you must have read the article. I am assuming bachelor, masters, and even PhD scholars here, right? So all of you have read the article, including the bachelors. Yes, no? Yes. Yes? Just raise your hand. Yes. I am not going to let you sit like this. Raise your hand. Have you read the article? Last benchers, have you read the article? Yes, you are blue t-shirt. Nice. Have you read the article? No. So, can anybody tell me how to read the article? Suppose I give you this article. This was published in the year 2025, recently, right? This is published by a Narayana A et al. And which is published in Clinical and Experimental Optometry, which is a Scopus reputed journal. Suppose you are reading this article, okay? You need to use 5 A's. Okay, what is this 5A? You have to ask, assess, appraise, apply and audit. This is the key features whenever you are reading the article. I know I am doing PhDs must be thinking why I am talking about 5 A's. This is for the bachelor, so all of you can connect. This is extremely important because I am being in research now. I am dealing only with PhDs. It's been like I am surrounded with PhDs. There are so many phone calls I get. Madam, please suggest one topic. Madam, please suggest one topic. So this is what is a need. People, you need to read in a depth, even a single article. Okay, so you will get multiple information from one single article. Then comes the PICO. Have you heard about PICO? Who has heard? Yes, somebody said yes. What is PICO? What's your name?
Ritika.
Excellent, Ritika. What is PICO?
Now once we go to some research paper, so just to justify whether this research is giving some outcome or not, we assess it with the help of PICO. Like if it is, for example, if I take, my research paper was, I studied about effect of esophageal cancer. Precisely it was studying the autogenic drainage technique. So how it is effective in stage 3 esophageal cancer patients. So before starting that study, I had to went through different papers. Like my guide suggested me to follow these guidelines of PICO. Whether the population that I have selected by doing inclusion and exclusion criteria, whether it justified based on this PICO or not.
Excellent. Perfectly she explained. Being proud of for Ritika. So this is a depth. Okay, so many times students get very scared. How much to read? Kitna read kare? Correct? So you don't need to be like you don't need to rush for that. You need to be very much focused. Find out, make your own parameters, and then start reading. That will give you lots of benefit. If you can see here, this is published in 2023, where optometry is standing in the globe. If you see, we are standing at 15th number. We are with index of 79, and the papers are 2,919. Guys, this is not a good number. Okay. Being number of colleges we have, number of students we have, so many students are passing out. Why our papers are not reaching globally? This is a question mark, and this is not a good sign at this 2026. So this can be improved very easily. Now we move towards the collaborative research. How many of you are doing research here? Raise your hand. How many of you are doing research here? Only one student? Come on. 3, 4. This side no one is doing any research. Bachelor, masters, PhD. Over this side. Only over there students are doing research. Huh? Yes. Ask her. Yeah, what's your good name? Soumya, are you doing any research? What do you mean by collaborative research? Just take out the head. What is collaborative research?
Where we collaborate with people and research about something.
Very good. So see, I am going to pick up anybody, so you have to be alert. Let's say B saying to me, but you have to be alert. I can pick up anybody. So collaborative research is when you are collaborating with the other. Now why it is a need of today? Why it is a need of today to be collaborative? Because if you go for a recent paper which are published in 2026, you will find there is a multidisciplinary approach. You will not find a single optometry or single pharma or single psychology. It is a multidisciplinary. When there are teams which are coming together, the chance of publication, the chance of getting funds and grants become very high. So the optometry we have seen over this 20 years, I have seen multiple collaborative work with occupational therapists, with engineers, with pharmacology, with psychology, with physiotherapy, and with the AI. Recently with the AI, number of publications, number of different researches are coming, beautiful researches are coming. Now, what do you see in this picture? What is your first perception? You can see one picture is there. I am going to just share one case study. So this is a case I am going to just discuss with you all. What do you see? I have not given the name of this device. Have you seen this kind of device? No. Anybody? Okay. This is a brain code device and she is a blind person. A blind person is able to visualize with the sensation which is sent from the tongue. So you can imagine the work which is done over here. Now how does it work? So you can see the same picture on the left hand side. There is a lady with a black goggle, yes, and there is a port transducer is there which is being pulled, and then there is a cup. The white cup is actual image, and you can see the pattern cup. All of you can see the pattern cup. This one. Can you see the pattern cup over here? This is what she is able to visualize. Okay. So on the left and right hand side, you can see how does it actually work. There is a camera in the glasses. And the camera is capturing, the information is going to the transmitter. The transmitter is sending the information to the tongue. From tongue, the sensation is going back, and they are using the neuroplasticity to visualize the gray matter over here. So the brain, the senses, the neuroplasticity is there. They are using the unused areas of the brain to visualize. So this is the level of research is going on. This was designed not by an optometrist. Okay, this was not designed by a team who were in the eye care. So you can imagine this is what a collaborative work is going on. So there is no limit. We need to collaborate because that is a need of today. Now, what are the challenges we face when we are talking about collaboration? Anybody? I think there is very less 2-3 optometrists are here, rest are physiotherapy and pharma. So what do you think, any students, I will be happy to hear the way Ritika has explained. What challenges you think a collaboration can come when you are doing any collaboration? Collaboration is a need or not? Yes, so both. Yes? So what is the challenge which you think is going to come when it is coming for the collaboration? Answer Geeta is there. Anyone to collaboration need lots of brainstorming. You need to come out of your comfort zone. See, right now which students are sitting, you are sitting in your comfort zone. You know your syllabus, you know your CGPA, you know you have to target, you have to get this much CGPA, you need to cross this exam, get this semester and complete your work, get your degree, correct? This is very clear. But a lateral thinking, which is a need of today, need to be developed, and that will come only with the collaboration, and you need to break your comfort zone. You need to pick up, you need to communicate with people, and conference like this is an excellent way to collaborate, where you are meeting with the people with the different domains. There are experts who are coming from different domains. So attend this kind of conference is going to help you a lot. The biggest hurdle which I have seen is funding. Have you heard about funding agencies? Any of this name have you heard? There are various names are here. Have you heard these names? Yes or no, students? Yes? So these are the funding agencies. And the funding agency always go for the problem. I am a recipient of Erasmus Plus Oculus grant of 95 lakh. I am a recipient of ICMR grant of 1 crore. So what these funding agencies are looking for? These funding agencies are looking for the problem which we are solving. In Erasmus Plus, we have been to all the European countries where we have developed the optometric curriculum equal to eco-curriculum. So this Erasmus Fund or any national or international, they are looking for the unique problem. And a fund which is being generated, it's never given to one institute or never given to one stream alone. That is the rule. So you need to have a consortium, you need to have a group of people with various discipline and expert in their field. Student grant, there are so many grants are here, you can see there are listed grants are the national grant. In the last you can see PRISM. Have you heard about PRISM grant? This is excellent for you. Why? Because in other grant agencies, you need to apply the grant, correct? And then you have to wait for the result. You have to wait for the result till they announce the result who has got the grant or who has crossed the level. PRISM is the only grant you go present, if you get it. So this is excellent for all of you students. So if you have any idea, collaborate with people, write grants. So there is lots of opportunities there. Funding is a kick to any research. Whenever you want to do any research, funding is the restriction because sometimes we need 50 lakh, sometimes we need 10 lakh, sometimes it is a bigger grant where we need to purchase an instrument. Correct? So grant is a hurdle and which can be easily solved if you are at the early stage. And student preference is always there in grant agency. So you really need to work together and aim for the grant. Now what is the impact of this research? All of you are students here. How many bachelor students are here? Raise your hand. Come on. Okay. How many masters are here? How many PhDs are here? Okay. So all the bachelors can connect over here. You are studying from books, correct? You are studying from the books. The books are really good. They are giving you the detail, the concept, principle, everything they are giving you, right? But the research papers are going to give you various evidence, which is a need of today. Correct? I was graduated in 2005. Amblyopia is a term where we used to study amblyopia, and there was, at that time, it was only patching the good eye. Now, there is no patching. See the transformation from patching to zero patching. So this came in a day. So this is what is a need of today. Because all of we are in a health sector, we are going to see the patient. You are not going to be theoretical physiotherapist or you are not going to be theoretical pharmacology, right? You have to deal with patient, you have to deal with the problems and you have to solve their problems. And the problems are coming every day. I am into my clinic also, I run my own optometric clinic. Trust me guys, patients are well educated, they read, they also have Google, they also have ChatGPT. They read and come to me. They ask me so many questions on one disease. So when they are asking me question, I ask them, please don't read ChatGPT and Google. If you want to actually read, I'll give you a research paper to read from there. Fine? So this is a need where you have to sustain yourself after when you are into a practice. So that confidence will come only when you are reading. Even curricular advancement, you can advance your curriculum that can help you only with the research itself. Your critical thinking is very important because I was also a student. I graduated in 2005. A student aim is to pass, get their degree, correct? First aim is that only. But the world is different now. When you are going to pass out, the world is completely different. You have to have a greater skill. And the skill is not going to come in a day. And that skill will come only when you have a critical thinking. And the critical thinking when you are analyzing various things. So agree, your syllabus is correct, your exam, everything is fine. But you, after that, you need to read for yourself to build your critical thinking, and that will only come with the good research papers. Now what is the need of today? All of you are in a health sector, correct? A patient, irrespective. I am actually from Mumbai. I shifted to Chandigarh last 10 years. I am in Chandigarh, but I am born and brought up in Mumbai. So it is whether I was in 3-tier city or 2-tier city. People don't have time now. I'm telling you a direct clinical work. Okay, people don't have time now, so they want customized for themselves. So that will come only when you are good in your research, when you are good in your critical thinking, not in agree syllabus you have to complete to get your degree. But when it comes to patient centric, you really need to be knowing what are the facts and figure what is going on in a globe. And that's how you can give a patient centric approach towards any treatment. It can be any treatment. The evidence-based practice is extremely important. That will make you update. Any recent therapy, any recent drug. I was hearing ma'am's presentation was excellent. I couldn't hear it much. But the way she has explained various research papers, okay, that is the evidence. Okay, and using those evidence, you can explore your other potential also. What all things we can do in future. So that is really required. Whatever work you are doing, how the globe will come to know. Suppose you are doing excellent in your field, how the globe is going to come to know. The globe will come to know only when you are publishing that work. And publishing not in any journal, publishing in the Scopus Web of Science good journals. And that is how you build your CV. A CV is not being, all of you work towards a goal, correct? You're studying, why are you studying? To earn your bread butter, correct? But in that CV, if you have good research work, if you have good collaboration, if you have good things which you have done, you have published, okay, unique thing, that makes completely different. And the competition is very high where you have to stand out of a crowd, you need to have a good CV and that will come only when you showcase your work in a global platform. Multidisciplinary approach is extremely important. In optometry, everybody wants to do PhD. This is which is my, because I am seeing every optometrist wants to do a PhD. They are not like, some are very much focused, some don't know. But maximum people wants to do the PhD. Now why they want to do PhD, they are not knowing. Okay, so this is not, should be a scenario. You need to work not only behind one thing. Suppose you are in physiotherapy. You know physiotherapists and optometrists come together can help ADHD and autism kids a lot. There's a rehabilitation centers are developed by optometrists and physiotherapists. There is a rehabilitation centers developed by the speech therapist. So, and various other streams come together and the rehabilitation centers are being established and they are working very well. So our multidisciplinary approach is extremely important. Now what is the future? Have you seen this before? Nowadays everywhere on screen we get this. We had Republic Day, even that in that speech it was being mentioned. Have you heard about this? What is this? What we will do in 2047? Anybody? What is our aim for 2047? It is written over there. What is the aim? Development. We have to be self-sustained. We should not be relying on anybody. Correct? So this is what a Viksit Bharat. And as a health force, there is a health coverage, advanced technology, and robust scale and highly skilled workforce. So we have to work for the workforce and the technology. Being the subject expert, being the expert of your field, we can work together for the sustainable future. This was a study which was presented in 2020 and this was the projection of 2025, that is 2050, it's going to be impacting the vision impairment. The vision impairment right now is there. It will be exactly triple in the 2050. So you can imagine the magnitude of vision impairment which is going to be increased in 2050. So this is a future where we are to deal with multiple problems and a patient-centric approach. The approach towards the patient for the treatment has to be multidisciplinary. So we have to have a multidisciplinary approach where we should not restrict ourselves to only one field. As I am an optometrist, I am not going to restrict myself only in the eye care. I am working parallelly with the psychology team. I am working parallelly with the physiotherapy team for development of various devices. We need to work collaboratively. The evidence-based practice has to be inculcated from the first year. It's not going to come after you pass out. So it's going to come from the first year. Somebody said, no, you're from first year. It will come from here. So you need to develop that habit. Reading is a habit which is going to be developed from day one. If you imagine, okay, let me pass out, then I will start reading, it's not going to be helpful. So we need to have the evidence-based practice to make ourselves ready for the industry, to make ourselves ready for the patient and self-sustained. So when you are into a field, make sure you are able to deal with any situation is there, and you should be self-sustained for all the problems which you are going to face. That's it. Any queries?
Thank you so much, ma'am, for highlighting and expanding the, about the research and the scoping practice of the research. So I would like Dr. Anita Arvind, ma'am, and Dr. Zafar Khan to kindly felicitate Dr. Renu Thakur. Give a round of applause, everyone.
Thank you so much, ma'am. Thank you so much. Our next speaker is Dr. Kamal Dua. Dr. Dua is globally recognized leader in pharmaceutical sciences, currently serving as a professor at Western Sydney University and an associate professor at the University of Technology, Sydney. Named one of Australia's top 250 researchers from 2024 to 25, and a national leader in pharmacology and pharmacy, he holds dual PhDs and over 20 years of experience across Australia, Malaysia and India. As a node leader at the Woolcook Institute of Medical Research, Dr. Dua spearheads high-impact research into novel drug delivery system and nano formulations, specifically targeting chronic respiratory diseases and lung cancer. His prolific output includes over 650 publications and 17 books, consistently placing him in the world's top 2% of scientists according to Stanford University rankings. Beyond academia, Dr. Dua is a pioneer in translational medicine and industry innovation, having secured over 2.9 million in funding and holding key patents such as 324 PCT for an agarwood oil nanoemulsion. He serves as a senior consultant for international pharmaceutical firms like D. Aurora and Pharmaco Biotechnologies, bridging the gap between laboratory discovery and commercial healthcare solutions. Professor Dua will be speaking on the topic Emerging Significance of Social Media in the Contemporary Academic and Research Environment, Tool, Trend and Transformation. We welcome you, sir.
Also, I would like to welcome Dr. Rahul Pratap Singh sir to kindly be on the dais for the session chair.
All right. I think can we just be quiet? Those who want to go, can you just leave the room, and can you just close that door as well? I am very strict with that, and it's very clear whether I'm in India or overseas. If you really want to sleep, you can sleep. But if you really want to get something, because I have traveled all the way from Sydney to India. If in this room, I don't mind, out of this population, even one person get the message of my talk and apply it in your life, my purpose of the talk is done. I'm not worried of whether it's 80% people are sleeping. So it's a very clear message. Okay, I think I do a lot of research. My research is in area of respiratory diseases. I work on asthma, COPD and lung cancer. And couple of my products with my collaborators, they are being reached to the commercialization stages as well. But I'm not presenting research today. And I will really show you something very unique which can change your life. Which can change your life particularly for the students and also all the senior academics, those who are sitting here. And this is really a very important topic. I think, how many of you have Instagram? Just raise your hand. That is the first foremost question. You need to be proud. How many of you have Instagram? I don't have. I think 80% of people have Instagram. How many of you have Facebook? How many of you have Facebook? I'm an old person, I have a Facebook. Few people have Facebook. How many of you have LinkedIn profile? Majority of you have LinkedIn profile. How many of you have Twitter, what we call X now? Most of the people have X, which is great. Now, on this slide, there are 3 terms written. Tool, trend, and transformation. Every day, we use social media so much. So much. We get up from the bed, before even we have our feet down the bed, we scroll our phone every day. Including your WhatsApp. But have anyone thought of that you invest so much of time, and I'll show you the real data of India in a minute, that how much of the time per person spend on mobile and social media and what social media. But do you think that social media, you really use it in a useful way rather than just the reels, which you see? A lot of reels. I'm addicted too. My daughter asked me on the other day, why you don't have the Instagram? I said, if I have an Instagram, I won't sleep at all. And I'm sure this young population, you try to sleep at 11 o'clock and you sleep in the morning 3 a.m. And why you do that? Because you continuously scroll one after another social media. Instagram, Facebook, LinkedIn, whatnot. But these 3 terms, tool, trend, and transformation, where you are standing today, it can take you to the next level by using social media. The best example I can give you during the COVID time. During the COVID time, you was not even ready to go to your next door neighbor to knock the door, thinking you might bring a virus. And how you was contacting them? You know, one house there might be a lady asking, Bhabiji, what do you have prepared today? And she's saying paneer. Oh, wow, on a WhatsApp? Well, but that was a social media. That was a communication. And it was making life so easy. And now, if you put any topic on a YouTube of your academic topic, anything, you can find a YouTube video of that. India was a boom. India, everyone was just recording the videos of their lecture and putting it online. Everyone started using social media to the next level during that period. So my talk is really going to show you something really different. Doesn't matter you work in research or you don't work in research. But if you work in research, it will help you to the next level. Now, where I'm coming from this small country called Australia. While born and brought up in India, I proudly call myself as an Australian Indian. I'm coming from this green highlighted area, which is one of the biggest states in Australia called New South Wales. And the 2 hallmark icons of this particular state and the country are the Sydney Harbour Bridge and the Sydney Opera House. And they're not very far from my previous university, which was University of Technology, Sydney. And I just started as a full professor just early this January in a Western Sydney University. Western Sydney University had multiple campuses, but where I am based is one of this heritage building which is on the screen. Heritage means you cannot even touch a brick of that. They just restore everything. Inside, it is a A-class, standard, new infrastructure, but outside, because of the heritage building, we cannot touch. This is a Westmead precinct, and in the Westmead precinct, it is next to a Westmead hospital and a research center. It forms 3 research centers where I'm coming from. One is called as the Marcus Institute for Brain, Behavior and Development, and I'm based in a second institute which is called as the National Institute of Complementary Medicine, Health Research Institute. It is the only institute in the Australasia which is totally driven toward the complementary medicine. And Ayush comes there to give funding because it is expanding across the globe. And the third is the TRI, which is called Translational Health Research Institute. It is part of both of these institutes. Western Sydney University had a quite a number of international students, and we have multiple campuses. We have one of the campus, which is the biggest campus, is called a Campbelltown campus. We also have a Bankstown campus, which had a very unique building and architecture. We also have a Parramatta campus, which is a little India of Australia, where Shri Narendra Modi ji just visited last year. That was Parramatta. We had Penrith campus and also the Hawkesbury campus. These are the multiple campuses within Sydney itself. And it's not just a one building, it's massive blocks and blocks and blocks of land is what the university is. Before that, I was in this university till early this year, which is the University of Technology, Sydney. It is in the center of Sydney. I'm still affiliated there on an honorary because I have my still research team going there. This is building 2, which is just library, only library. And this building is very close to the Sydney Harbour Bridge and the Opera House. The bottom one is the Graduate School of Health. The 6th level, the glass building which you see are the 6 levels where the Graduate School of Health is there. We have physiotherapy, we have orthoptics, we have genetic counseling, we have speech pathology, we have pharmacy, and we have good manufacturing practice and indigenous health. But the beauty of this building is at the bottom of this building, the red color building is a pub. It's a thika, what we call thika in India, right? It's a pub. So when you get a grant, you go there. When you don't get a grant, you go there. It's such a unique building. And then I'm also a research leader in one of the top research respiratory institutes, which is a part of a Macquarie University. It is called Woolcock Research Institute. It is based in Sydney as well. Most of my human clinical samples come from Hunter Medical Research Institute, from the bronchoscopy, and the bridge which is coming out of the building is connected to the John Hunter Hospital, which is a part of the University of Newcastle. And Centenary Institute is another where some of my PhD students, particularly mitochondrial damage studies they do there, but it's a part of the UTA and the University of Sydney. Now this is all bragging about me. Let's stop that. Let's come to the main agenda. I'm not presenting any data, any research. If you want to see my research, Google exists. Read the paper. I presented in the last conference research, but I really picked this topic because I thought it will change your life. It has changed my life. It has changed my collaborators' life. And they are the real evidence which can give you the answers. Let's start with some questions and give me a very honest answer. Very honest answer. Every day, everyone has phone in your hand. And I can bet you some of them are still on phone, whereas I'm talking to you. Your thumb goes day and night on that. Your finger goes day and night on that. The first question is, how many times in a day you open social media? Just give me a roughly number. Let's start this side. How many times in a day you open social media? Any social media, just rough number. WhatsApp as well? Yeah. Every minute. Just still anyone from middle? Anyone? 20, 30, 50, 500, 1000? Sorry? Lie? 2 times. You're telling lie. On that side. 50 is also not a real answer. Okay. 200 is still okay. Does it really help you with your professional growth? Does it really help you? Even I can see on WhatsApp now, every university, every school have their own group. More than the family group, you get messages from, Madam, come to the office. Madam, NBA accreditation is coming now. Madam. Oh, Madam is saying, oh my God, WhatsApp is the next level problem. There was enough at home. But does it really help with your professional growth? And professional growth means you all are a bachelor students. You definitely want to do a master from a good university. And this is your chance, and I'll show you how. If you really want to do, I get every day, almost every day, 2 to 3, or maybe sometime up to 5 or 6 emails from different people across the globe, those who want to join my lab. They want to come as a PhD student, they want to come as a postdoc. My postdoc is speaking tomorrow. Keshav would be here. You can hear the microplastic research. It's an amazing research he's doing in Malang. Amazing microplastic. I have just been interviewed along with him in Georgia. Online interview. It is on Google and YouTube as well. But YouTube is also a social media. I'm getting publicity. Why Georgia people, TV people, media people has contacted me? I'll show you in a minute, and Dinesh will give you that answer because he's on that paper as well. And the last thing is, do you think it is worth investing time on social media? It is. The answer is yes. This is the purpose of my talk. You don't have to say yes and no. But how? Every day it's good to go on a reels as well because we need our personal time. I'm not talking about a dating apps, which is also more or less a social media. You can find your better half on a dating site as well. But what I'm talking is a professional growth. I'm not reading all this, but it's an old data. Let's just look at the world whole map. It clearly shows India is not too bad, and India is really doing very well. Almost close 33% of the people are almost using the social media in India as compared to the Western countries. But if you really want to see the true raw data of India, you can clearly see it has almost a population of 1.46 billion people across. Out of that, the cellular phones, those who are carrying, including us, is almost around 1.12 billion people. Out of that, if you really see the people, those who are having internet at home, is around 806 million people. It's a big audience. You know, in an olden times, if you remember, I think you guys are young people, maybe academics there. In the newspaper, there used to come a pamphlet. You know, even if a new shop opened across the 10th Street up, they had a pamphlet of the shop. So that you go to the shop and get the business done. You don't have to do that. It is just on your phone, you just put it a little WhatsApp status. I don't know how many people will see that. And it is just like how you spread the word across the world. And almost the social media users in India are around 491 million people. Shri Narendra Modi ji also have a social media profile on LinkedIn and Twitter. Why? 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 Let's talk about Shri Narendra Modi ji in a minute, but let's talk about another president in a minute. But before that, there is more statistics. I'm not going through all these statistics because it clearly shows almost average of 2 hours, 28 minutes out of your 24 hours you spend on social media. On your social media. This is the reality. I can tell you, you can travel in a car most of the time on WhatsApp, Facebook, Instagram, what not. But are we really using it for a professional growth? But if you see, we talk about politics. Tell me the name of the country and the name of the person whose social media account was blocked because he was using that social media for his politics in a very wrong way. And who was that? He's back again now. Who is back? Donald Trump. Donald Trump. He's back into the politics. He's running the biggest economy of the world in the government. And his Twitter handle was blocked. When a person like him can use for his publicity, then why not ask for our professional growth? But how to use that? And how to create that vibe on a social media in a positive way? This is the trend of the different social medias people use across the globe. But Facebook is really on the top. Why? Why Facebook is still number one, not the Instagram? Why? There should be an answer. Global reach, okay? Is there any other answer anyone thinks? Yeah, there might be. Yeah. You got half answer I got from you. Anyone else? Why do you think the Facebook is still number one in social media? Marketing. Marketing on Instagram is better than Facebook now. I think so. Yes, it is because across the globe the elderly population is really high. Everywhere the elderly population is really high, and because once they stick on any social media, they will never change. And that's why still the Facebook is really quite high. Every single publisher, someone was talking before me across publications and stuff. I got this email just yesterday. Look at that, Springer is one of the renowned publishers, and they send me a survey on social media. how I use on my research. When a reputed publisher can use that, then why not us for our publicity? Why not us? And then there are so many things, like an earthquake came, a flood came, any news came, you can easily pitch on a social media and people will get warned. And this was almost 15 or 18 years ago when I was working in IMU in Malaysia. I published this paper. And at that time, I showed what people started using during the COVID time in India. I don't know how many of you have heard of a platform called Moodle. How many of you have heard of Moodle? Moodle. How many of you have heard of Blackboard? How many of you have heard of Canvas? Not Canva. I'm not talking about Canva drawing your presentation which my daughter uses well. I'm talking about Canvas. These are the educational platforms which university buy the licenses to run their programs. And you can do what people started doing during the COVID time, e-lecture, e-PBL, problem-based learning, e-tutorials. I presented that almost 18 years ago when I was teaching in IMU and we were using those platforms. We were literally. In Australia, when I started there, it was almost 14 years ago, we used to have a Blackboard, now we use Canvas. Canvas has had a very high level of features. And when I was interviewed for my PhD in Australia, I was interviewed on Skype. Now no one uses Skype. And when I was being interviewed, I was worried if the internet connection goes, my interview will go. You really have to make sure you have a stable internet connection, you sit properly, you talk to the person in a nicer way, and now you guys have a phone in your hand. And you can talk on a WhatsApp, on a video call to anyone for 1 hour or 2 hours. I talk to my mother every day from Sydney on that only, on WhatsApp. It makes our life so easy. And even when I applied for a postdoc after my PhD, I literally sent a hard copy letters to United States. Then I got in University of Newcastle, South Africa. I got all those three to the hard copy. And I still remember my very first publication in Kannada Drug Delivery, which was almost 20 years ago. They sent me the copyright form. And that copyright form, it needed to be submitted through fax. And they said, they say the same thing to welcome people within 48 hours. And I was worried if I don't send, they will not accept my publication. This is for my PhD. And I have to go to a fax shop. I paid 400 rupees at that time. It was a big value. And now you can scan with your phone and send the thing very quickly. So everything is in your hand. And how you use social media is really important. In pharmacy, we use a lot in a pharmacy practice because we recruit a lot of patients. In any of your studies, if you have to recruit the patients, it's much easier to get the publicity through the social media. These are the main three social media. Which one is better? Which one is better? I'm not talking about Instagram. Instagram is not really being used for professional purposes at the moment. And there are no evidence around that. But, sorry? LinkedIn. How many of you say LinkedIn? Almost 40%. How many of you say the little bird which is changed now to X? Twitter. 1, 2 people, 3. Okay, and we don't talk about Facebook because Facebook is little outdated now because it's only used for people like me who is elderly. Why we use social media? I'll give you one answer and then I'll ask you quickly because we need to wrap the session. I have a lot of things to talk. The most important thing is I find Flavia through social media. You're going to meet Stephen Kerr from Massachusetts College of Pharmacy and Health Sciences in the afternoon. One of the oldest pharmacy college in United States. I met him through LinkedIn. Tevin is here. I met him in a conference in Taiwan. And then we connected and look, he's here now today. Evie, you're gonna see Evie tomorrow. Dinesh is with me for so long. And even KY is there as well. There's so many people you're gonna see. I got connected to almost 80% of my collaborators and I can map. If you really see a good researcher profile nowadays, you see the most important thing is called demographic spectrum of your research. It means, and on every website in international profile of your, on the website, they have a demographic, which clearly pins this person had a collaboration in States, Australia, America, Africa, India, whatever, Japan, Turkey, or whatever. So all the networking and partnership you can get through social media. What else? What else? Anyone else? What else we can get out of the social media? Let's quickly, because I'll show you something really good then after this. This is just a basic thing. Quickly. What do you do on social media? Other than networking and partnerships? Anyone? I'm sure there's a lot to do. Well, come on, there is some answer, right? Sorry, current achievement. If I publish a paper, I definitely put that paper on. And Dinesh helps me a lot, and he can tell why we do that. But by which platform we do that, and why we do that is important. And why do you think which platform is important? No, not at all. It will never give you any value other than just your people say and say congratulations. It's of no use. Jealousy is one thing, but it's of no use. No use getting on LinkedIn. Anyone else? ResearchGate is just more for people can see and refer. You may get some citations out of it. Sorry? Google Scholar automatically picks. This is a good thing. This is a good thing what we got another advantage. At least we can showcase our achievements and research. What else? What else? Job opportunities, very good. You can find your next PhD with the full scholarship with me on internet. There are so many of my collaborators, they post their postdoc opportunity. If Dinesh got a funding, he wants another postdoc, he can post on social media. Flavia had a postdoc even from India who finished and gone to States now. And it all came through social media. This is great. What else? What else? Correct. And you get the negative feedback as well. So it means the feedback. Feedback is important. So it's a positive, it can be negative. So feedback is important too. What else? And one more point, and then I'll show the answers. One more. Information. Correct. So ResearchGate is commonly used nowadays. People even post the problems. I'm using this cell. It is not growing well. I'm using this media. Can you help? And people provide actually the answers. I'm doing this. Can you try this? Which is good. But the real answer is, if I am posting anything, and if Dinesh is reposting that, I have 6,000 people sitting on my LinkedIn. He has another 6,000. 12,000 people will get that, kind of the dissemination of the knowledge. And that dissemination of the knowledge leads to multiple things. I'll give you a simple, straight example. I am very unsuccessful in government funding. Highly unsuccessful. With 0.1, 0.2, I miss my grants. And I literally get sad for one day and I get normal. I had NHMRC, which is the top leading grant of Australia. Brian, you're gonna see Brian tomorrow. He just got 1 million grants from NHMRC. I have missed many, but I'm still surviving, striving my lab. In Australia, no university give you even a single 10 cents to run the lab. I have 8 PhD students from 5 different countries. I have 2 master by research. I have 1 postdoc, and I'm running my lab at my own. And my all funding comes from industry. Everything comes from industry. And all industry, and they feed me from $100,000 to $250,000. And why they do that? Because if I pitch anything on social media and I tag that company, I got recently a project from France from a company called Genosis by Lesotho. They work on women health. They do quadrafolic salt and they mix with vitamin K2. So they contacted me through another collaborator in Sydney, which is Complementary Medicine Group, and they asked me, don't say you work on asthma, COPD or lung cancer, just say you are doing and testing our product for lung health and longevity. What's a nice sexy term? Lung health and longevity, because everyone wants to live longer. Everyone wants a big life. So don't say you have asthma, you take this. You have COPD, take that. You have lung cancer, you take that. You just say lung health and longevity and do this testing, what you normally do in our lab, and they gave me 18,000. And it is just, if you see on LinkedIn, I may post in another 10 days something, I'll tag 10 companies in that. And I'll tag the key people of those companies on that post. And when any of those people see that, they feel acknowledged. And that acknowledgement, you don't know maybe lead to the $10,000 to $100,000. But do you do that? Any of those researchers? Not really. You go on Twitter. Go on Twitter and you will see your DST, DBT, SERV, any funding, ICMR, everything have a profile on Twitter. They do announce the date, when it opens, when it closes, the successful applicants, they tag those. And there are so many people I know, particularly in the central belt of India, particularly from the IITs and also in Mumbai, those who are proactive on Twitter. So we can have a large audience group and we can easily enhance our visibility. We can get a lot of feedback. We can impress potential customers. Every single university has a nowadays Facebook, Instagram account. Any small thing happening in a university on the next level, they put it there. Because you don't know, instead of 10 recruitment, you may get another 10 recruitment. Some of the universities, they pay more to the marketing people than the academics. Better to be in a marketing rather than academics. You get a branding out of it. And if Dinesh and I are working on lung diseases, and if he's doing something new and I'm following him, I can clearly see what he's doing, so that I can do something different from him. So we can easily see and track our competition. So these are some of the advantages, but I'm not going to play this video. Whenever you have a time, it is from University of South Australia, just because of the time. Just YouTube on University of South Australia social media. It's a very beautiful video. They have the real answers from 6 researchers why they use social media. But what is the main purpose of using this social media in academic and research? All these points which I have shown you, it leads down the funnel to one thing. What is that? What is that? We talk about all those points, you know, I get so many audiences, I get my visibility as an organic, but what is the down the funnel, the main outcome? Funding. And funding is also, what's the right term? It is called actually impact. Impact can be any form. It can change the policy. It can change the trend of X thing. It's called impact. And even if you manage to get your postdoc, it's an impact. You manage to get your PhD with full scholarship, it is an impact. When I started my lab in Australia in UTS, which was almost 9 years ago, I started recruiting, my first 3 students were Indians. And I heard from my lab, the other white people, are you creating a little India here? I said yes, because I feel like they are quite confident people, they work really judiciously. And then at the moment I have students from New Zealand, I have students from Iraq, Lebanon, I have students, quite Australians, and I have student 1 from India. So I have a very mixed setup. And they people really are the ones who generate the impact for me. They do those industry projects, I present the data. I recently presented 2 weeks ago, Keshav, you can ask Keshav tomorrow. We have created so much of cell sequencing data of Gnosis product. And they're happy to patent it. And in my introduction, someone said Agarwood PCT. Dinesh and I had a common PCT of that. And the company happy to take that to the commercialization. He developed the product, I did the biological testing, and company already launched that as a PCT in 5 countries. Not even 10 cents IIT has spent from our pocket. Nothing. They gave the money to us to do the research. We created everything for them. They did the patent in 5 countries with our name on that, and they want to take it to commercialization. That's impact. And nowadays in Australia, in research grants, no one asks about, tell us about your Google Scholar H index. They say, you list top 10 publications. In any grant, now they ask, just list top 10 publications and why you select each publication in 250 words, what is the relevance of that grant. And they don't ask in the bracket, don't give the impact factor of the journal, don't give the number of citations of the paper, you have to only give FWCI. What is FWCI? What is FWCI? I have something important to show quickly, I think I'm running out of the time. Sorry. FWCI. Sorry? Field Weighted Citation Index. Take note of that. Take note of that. Every single researcher, doesn't matter it's Padma Shri or Padma Bhushan, no one talk about citations in western part. Everyone just talk about field field-weighted citation index, and that can make you naked clearly. They just want that on your research grant to get successful. I used Facebook ages ago for my research students when I was in IMU, because students reply to on Facebook is quickly as compared to email. So I created a group to run the research show on Facebook. But I think this is the important term. I'll quickly wind up in 5 minutes. What is this now? What is this? Anyone? This is something sounds like a mathematical term. Health matrix. What it is? Anyone? Very good. Very good. Thank you. In a very simplified way, other than the number of citations you get out of your paper, any newspaper blogs, any media, any Mandali, any Twitter, listen carefully, any tweet, doesn't matter, Dinesh make that tweet, Flavia make that tweet, I make that tweet. Flavia, you have Twitter handle, Dinesh, you have Twitter handle, I'm sure 80% of the researchers have Twitter handle. Any retweets, if I have published a paper with Elsevier, I tag Elsevier. I tag all the co-authors. Say I have 8 co-authors, 8 retweets will give me Altmetrics. Elsevier will see that, Elsevier will retweet. One of our best example of the research I can tell you is the berberine research. You now leave the berberine. I think we can talk about the recent one, which was a month ago, the microplastic, a month ago. So one of my students, in a collaboration with the University of Auburn in Alabama in the States, he wrote a paper on microplastics effects in Alzheimer and Parkinson. Microplastics are everywhere. This is microplastic. The plastics are leaching into the water which you are drinking, and they are so micro that you can't see, and it is causing health hazards. And we showed that it is very detrimental in Parkinson and Alzheimer. Within 1 week of the publication, within 1 week, how many news blogs were there? How many around? 250. You can Google, I'm not kidding. 250, including BBC. Including BBC. I was invited by Georgian TV to talk. 250. And this is called impact. This is called Altmetric. And when you write in your grant, my research has demonstrated substantial influence in the media. This is what is the Altmetrics. Altmetrics is all around your attention score competition. Doesn't matter, it comes through Mandali, Twitter. If you have a research paper, tweet it. Tell your friends to retweet it. You will get Altmetrics out of it. This is just an example of one of my paper, which was published ages ago. You can see it's not the latest one. Immediately after 2 hours, I took this screenshot. It was having an Altmetric of 5, which shows here. It means 5 people across the globe. You can clearly see through the map which particular area. It was through Australia, it was through Malaysia, and few other areas. So few of my collaborators retweeted, and that increases the Altmetric score. I'm coming to the very last bit. I think I can do this workshop for 1 whole day. Even Dinesh can stand next to me and he can tell you how to write your LinkedIn post. Never ask ChatGPT to write the long stories. No one have time to read your long stories of your LinkedIn post. LinkedIn post, the best LinkedIn post is the first 4 sentences, anything. People get attention to that. How many of you have heard of Google Scholar? What exactly Google Scholar gives? Anyone? What does it give? Research papers. What else? What else we can find through Google Scholar? In India, everyone is fan of Google Scholar. Every research grant you go, I review so many grants across the globe, but I never go through this. I go somewhere else, I'll show you where. What else? What else we get from Google Scholar? Number. Okay. Yeah, so you find number of citations, you find H index, I-20 index, but do you think that is a real number? That is your real H index? That is your real number of citations? No. This is fake. Purely fake. Then where we go after this? Where should we go? Okay, very good. Thank you. Then we go to Scopus. You can clearly differentiate your total number of citations and your H index would be very different when you look at the Google Scholar and Scopus. Scopus always have less number of citations, less number of H index, I-20 index, everything is very less. But that is also not right. That is also not right. And the same company, same publisher developed a new tool which has been used from last 6 years that can make you purely naked in your research. And that gives you your everything. That gives you your total number of citations, that give you H index, I-20 index, FWCI, that can even give you how many international collaborators you have, that can give you year by year, Q1, Q2, Q3, Q4 publication, that can even give you how many of your paper being used for patents, that can give you how many of your paper have been used in media, everything it will give. And what is that portal? What is that portal? What is that? It's not the Google Scholar, it's not the Scopus, that it's called SciWell. If you don't have gone to that, go to the SciWell. SciWell is also a part of Elsevier. Scopus is part of Elsevier. Google comes all around the globe, anything it picks. But the SciWell gives you everything. Every single organization, institute have a SciWell account. And you can compare the competition of the institute to institute, their H index, my H index, and individual to individual as well. And you can even find who is the best researcher in your university in any discipline. I'm not going in detail, otherwise I can show you in SciWell, there's so many features. But I'm stopping here with two things. The first important thing is, what's next now? Because you have seen there's so many good important social media and you can use it in multiple ways. I have just shown you, when you have a research paper, use Twitter. That will give you Altmetrics. Use your research paper to make right connections. You are an undergrad student, try to connect to the right people at the right time. If you connect and follow that person, and when you write an email to that person will definitely see, oh, this is a person following me, I should definitely reply to that. Otherwise, no one bothers. Everyone is busy with their life. So how are we going to use this social media? Your feed is your future. How you write your social media post is your future. That post, whatever you do on a social media, it can change and fuel your career. Social media, as I said, it is a tool which we usually use for dissemination, recruitment, collaboration, like LinkedIn. We use as a trend, particularly in our research, which is like a Twitter. And it is a matrix, which we talk about H index, number of citations, I-20. This matrix is a pressure. It's a pressure on every researcher across the globe, everywhere. And the last important thing, it's a transformation. How you use that, you can build a public trust. And I get so many grants from Europe. I just reviewed 2 grants from A-Star Singapore. They paid me good money to even review the grants because they found that I work in lung diseases. And that grant which I reviewed, they were having a collaborators with Amazon. How the hell on the earth I will never give that funding to them? I will say yes. With this, I would like to acknowledge some important people actually. I would like to acknowledge Professor Sahil Arora, Dean of the Health Sciences here, who has actually invited me, been in touch with me for such a long period to make my physical presence here. Dr. Dinesh Dell, who came this morning even to get, and all the organizing committee of the REACH 2026. I would also like to thank my own research team actually. I had quite a big research team who actually do the work in laboratory, and I'm not showing any data to make you bored at the moment. That's why I really thought I'd show you something nice. Every single student of me has Twitter handle and LinkedIn. And every single student retweet the paper to increase the health metric of our studies. And the last but not the least, I would like to thank actually my school where I just started. Dennis is currently the director, and also Graciela from the School of Science. Previous school where I'm still on honorary, Charlie and Kylie, and also Brian, you're going to meet tomorrow where I'm the research leader with the Blue Hawk Institute. How many papers you reject nowadays? If you reject a lot of papers, you go to hell. If you pass the papers, you go to heaven. But this is the reality. With this slide, I can stop. Can you compare both of these slides? The photo is same, but the person, the way it is being said on the screen is very different. See the impact on the right hand side as compared to what the dog said. I just barked on the neighbor dog. But that barking led to something impact. It made the people or the thieves go away. This is how you need to brag yourself, your research. Doesn't matter, you attended this conference? Tag yourself in that conference. Tag GD Goenka in there. The university will get the promotion, you will get the promotion. I just presented one conference 20 days ago. It was an online conference in somewhere in Ahmedabad. Oh my God, it was just an online. It was 4 people, one was from France, one was me. Almost 5 students have tagged 5 different posts, all the speakers, including the university they attended. They presented some poster and have their photo. Now you see the impact. You getting an impact that you attended a conference. You showing that you presented a poster. You tagged GD Goenka, which ran the conference. That got you promotion. You tagged all the speakers that clearly show our visibility physically here and also the presence in GD Goenka. So ultimately, how many folds of the outcome you are getting out of one social media post by one person? And anyone who will like it will see that. And any people, those who are connected to that one like will see that. So you really need to learn that. And I don't run that workshop for my team. Dinesh is the one who do all our most of these writing for the research course. In our team, all our collaborators, we have a divided jobs. So until and unless we not work together as a collaborative, as a team, we cannot reach anything. We cannot reach. I think I have made bore everyone, but if you really take strategically instead of TikTok or instead of Instagram, you can spend 15 minutes, 20 minutes on Reels. But 20 minutes of your hampering post on LinkedIn, connecting to the right people, or on Twitter, referring to the right bodies. Every single professional body had a Twitter handle. Every single professional body. Doesn't matter, physiotherapy, orthoptics, pharmacy. You follow those bodies. You get a lot of new announcements. There are so many travel fundings for the undergraduate and postgraduate students. And now in the last 1 decade, Indian government is putting so much into the funding. So much into the funding. And you really don't know, you might be the next winner. With this, thank you so much for being patient, and I can see no one's slide. Thank you.
Thank you so much, sir, for sharing such an insightful and trending topic. The session was truly informative and interactive. May I now request Professor Dr. Zafar Khan and Dr. Rahul Pratap Singh to kindly felicitate Dr. Kamal Dua.